I will never forget the day that my grandmother got sick. She almost had a heart attack. So that day, I was all alone with my grandmother in the house, and all of a sudden, she fell to the ground. And I was too small to keep her from falling. So uh, I looked at her. She was on her knees on the floor, and me not knowing what to do, I freaked out. And I remember I just called 911, and the EMT, the emergency department, came and took her to the hospital. And once I got to the hospital, I went to her room, and the nurse that was taking care of my grandmother said if I took her blood pressure that day because her blood pressure was really high. Me being a 13-year-old did not know how to take blood pressure, so I said no. But the nurse was really good, was really nice to me, was really nice to my grandmother. She knew what she was doing. She took care of her, and my grandmother was out in a couple of days. So from that day on, seeing what the nurse did, I decided to continue a profession in nursing. So I'm going to share information on the process of becoming a registered nurse, a profession which I'll be fortunate enough to accomplish in a couple of years. I'll first inform you of the education requirement, and then share the income in this career, and finally I'll talk about the job outlook of becoming a registered nurse. So to become a registered nurse, there's three key requirements that needs to be met. So first, you need to graduate from a nursing program. Second, you need to complete you need to have a clinical experience. And then finally, you need to pass the national examination. I had a friend once who went to a accredited nursing program, and she passed the national exam. She had a very good people skills, but when she applied to a hospital, she did not get accepted. They told her she needed an experience in advance, supervised experience before she could be hired. So she went on to a long-term facility, and she volunteered for a few years, and then she applied to a hospital. So nurses who want to further their education in this field can also become nurse practitioners, nurse midwife, and anesthetist and other fields. Usually requires 2 to 4 more extra years after becoming a registered nurse. Additionally, for example, I am a third year in a nursing program, and usually it's a competitive field, so it requires a GPA of 3.5 to 4.0. After that, after you get your prerequisite, and then you can go on and apply to an accredited program and go to a 2 more year school and then be certified as a registered nurse. And according to the Washington State of Nursing Care Quality Assurance, the WIS, RN requirements to be certified as an RN, you need to complete an approved school of nursing program, pass a national examination, and you need to complete 7 to 8 hours of HIV or AIDS program every year. As you can tell, the years to become a nurse is quite long, and it takes a lot of patience to complete this program. But people may think that a higher or longer school year means a higher income or salary. According to the Bureau of Labor Statistics, a registered nurse who completes a 2-year prerequisite and then 2 years of nursing program to get the bachelor degree makes roughly about $58,000 per year. Although this wages slightly differ from one employee to another. For example, if you work in a hospital, you make slightly higher income than if you work at a doctor's office. So when you look at the WIS, the Career Information System with a nonprofit organization, they looked into the Washington careers or the Washington nursing program, or the nurses that graduate in Washington State make about $41,000 per year, which would be $26 an hour, and they roughly estimated $35,000 to $4,000 per month. So this salary seems kind of high, but it's very important to know that these nurses work full-time, they work longer hours, sometimes overtime, and they take care of a lot of patients at one time. So this is a very stressful job. Now that you know about the income level, let's take a look at the job outlook of becoming an RN. According to the national survey that was done in Washington's Center for Registered Nurse back in 2008, there was an estimated 3 million registered nurses in the United States. Looking, this number shows that there is a high number of registered nurses within the US as well as outside. personally, I know from 2008 to 2015, this year, there were a lot of nurses that I know who graduated and went on to work in Washington State, personally in Seattle. Um, as stated by the licensed of Washington Department of Health, there is about 65,000 RNs that go to school in Washington State and become certified in Washington State, but move on to work at states outside of Washington. And under the WIS, it's shown that between 2008 and 2018, there will be an estimated of about 17,000 new jobs available in for RN positions, and there will also be about 1,000 jobs yearly open due to retirement or other circumstances that require people to leave their career. So this is a very high demanded career, and people retain this job for a very long time. And according to WIS, it's estimated that this country will have a shortage of nurses. It is estimated about 800 million or 800,000 RNs will be in demand as of 2020. However, in the past 6 years, there has been an increase people going back to school to attain their RN degree. Also, WIS says that currently an average age of nurses are 45 years old, which they're pretty close to retirement, and there will be a lot of jobs open and in demand for RNs to take the position. So as a result, many schools are increasing their acceptance rate of nursing program. Well, you've seen that RN won't have too much trouble finding a job. The salary is great. The years spent in school is well worth the reward that will be given afterwards. So I hope I gave you information that you need to know if you desire to pursue a career in nursing, or at least pique your interest. So you could be like me, who experiences a loved one having a traumatic experience, or I feel helpless. Or you could be looking for a career that's filled with helping people and encouraging the health and wellness of others. So you don't have to feel helpless like me, and you could be empowered. You can be more equipped to handle a health emergency situation at any time by pursuing a career in nursing. Thank you.